All right, don't take this the wrong way, but doctors make terrible patients. We don't take care of ourselves as well as we tell everyone else to. Routine appointments get pushed to when things slow down, which is almost never. We convince ourselves we can be objective about our own health because, after all, we went to med school. And underneath that is the very human ego that doesn't love saying, "I don't understand this," about something we feel we should already know. Not only are we bad at being patients, but we also change how we practice when the patient is a doctor. When we're talking to another physician in any situation, we slip automatically into doctor mode. Not just the Greek and Latin, but a kind of shared shorthand, sort of like two veterans talking about war. There's a built-in understanding of training, call, complications, loss, and struggles. So the conversation is shorter, more compressed, with a lot of mutual assumptions. The problem is that shorthand often carries over when one doctor is actually taking care of another. As the treating physician, you might start skipping the details you'd normally spell out for any other patient, because they should know all this. As the physician-patient, you start filling in the gaps with your own knowledge and biases, assuming you understood everything correctly. It becomes a little bit of the blind leading the blind. So how do we fix that? Now, I'm not sure there's a perfect solution. It is a very ingrained habit, but there are a few things that can help. If you're the patient who happens to be a doctor, force yourself to say, "Can you explain this to me as if I'm not a doctor?" Feels a little awkward, but it does signal to your doctor that you're not asking for less information, you're just asking for it to be clearer. Also, read your notes. A lot of the time, we get an automated message after a visit saying we have records to review. Take a minute to actually read them. Sometimes you'll find a plan or explanation documented that you don't remember hearing, or that doesn't quite match what you thought you agreed to. If you're a doctor taking care of a physician-patient, pay attention to your language. Try to translate into plain speech as you go, even if you know they speak medicine. Watch them carefully. Look for the same confusion, hesitation, or "I'm not okay" signals you would look for in any other patient. Don't let their profession keep you from reading their reactions. It takes a lot of effort to undo patterns that were cemented by years of talking to colleagues in shorthand. It also takes humility to admit when we don't fully understand what's being explained to us, and to recognize when the other person in the room might not either. But if we can learn to be clearer with each other, both as doctors and as patients, everybody wins. So thanks for watching. Don't forget to hit like and follow, and I'll see you soon.